The procedure went well. So it's a patient who had an obstetric fistula. So the patient had an extra trigonal fistula. So they did a vesicovaginal fistula repair, a low transvaginal vesicovaginal fistula repair using a neighborhood graft, or what we commonly call the Fuda technique. Some people fix fistula by just closing the defect. The Fuda technique adds an additional layer onto the repaired defect. And the particularity about the Fuda technique, there are other techniques or flap techniques, but this one you don't go far to look for the flap. So you take a flap which is just close to the fistula itself, you use it, you rotate the flap to close the fistula. That is the particularity about the technique. It is less invasive and of course with good outcome. So a fistula is an abnormal communication between two mucous layers. But I'll talk more about the vesicovaginal fistula, which is the fistula we are actually talking about here now. It is actually an abnormal communication between the bladder and the vagina. So there are many things that can cause vesicovaginal fistulas, which can